we are just about at the end of our time together, but we do have one more great plenary, and we've saved some of the best for the last day. Over the last few days, I do hope you, like me, have learned a lot, come to understand a little bit more about GLMA, and are as energized as I am for the work that we have ahead of us to protect and promote the health and well-being of LGBTQ communities. As has been shared throughout the last few days, we have some tremendous opportunities at the federal level to advance health equity. And at the same time, we need to fight hard against the backlash we are experiencing, especially the backlash that is targeted at transgender youth, particularly at the state level. As GLMA Executive Director, I'm heartened to be in this fight with all of you, boldened by your expertise as health professionals, committed to making a difference in the health and lives of LGBTQ people. Thank you for your support of GLMA and LGBTQ health equity. And now we turn to our last poll question for our conference. Assuming we are able to meet in person, will we see you in San Francisco in 2022 for the 40th anniversary celebration of our conference? Let's just take a few seconds for you to fill out that survey, and we'll close it in 3, 2, 1. Let's see what the results are. Well, vast majority are definitely planning to be with us in San Francisco. I hope some of the others who haven't made up their mind yet will definitely hope to see you in San Francisco as well, and hope to be in person. One last word I want to share about continuing education and evaluations. Remember, we have two separate kinds of evaluations: the session-specific evaluations, which you can find on the Event Hub through the View Sessions icon. And then we have overall evaluations for the Nursing Summit, and overall evaluations for the Annual Conference on LGBT Health. These are now available on the Event Hub, so you can fill them out. And remember, it's the overall evaluation that you need to complete so that you can request continuing education for the conference. More information all on the Event Hub about continuing education and evaluations. And now it's my opportunity to share some appreciations for the team that produced this conference. First, a huge thanks to our technical team at M Squared On Stage, led by Keith, Go Georgia Bulldogs Johnson, the senior technical producer, and Ashley, I Got the Playlist Mills, technical producer, and their entire team of tech staff at M Squared On Stage. They have made our second virtual conference run so incredibly smoothly, and we are incredibly thankful for that. The next person that I want to thank has been the key player in our conference since 2016, Debbie Eagle Eye Cook of Meeting Masters, Inc. Let me paint this picture. In Debbie's office right now, there are 6 computers that she is monitoring. So by the time someone has let her know that there's a problem in one of the sessions, she has already emailed me 5 minutes ago to let me know that those problems are being resolved. Debbie, we've been working together since 2016, and you've helped us navigate some daunting challenges the last 2 years. Thank you so much. And now to the GLMA team. Kyla, the backstop Milovitz, they just joined us a couple weeks ago and have been mainly behind the scenes, filling in however and whenever needed to just get the job done. Thank you, Kyla, for your hard work and dedication. And last, but certainly not least, Margaret Superglue Hughes. There are not enough superlatives to share my appreciation for all Margaret has done to make this a super successful conference. There isn't a part of the conference that Margaret hasn't been involved in, while also making incredible contributions in the other parts of GLMA's work. So Margaret, thank you for your dedication, your hard work, and your good humor through it all. And now to present the final 2021 GLMA Achievement Award, I'm pleased to introduce GLMA board member and former vice president for the Lesbian Health Fund, Shayla Mangi, a hematologist, oncologist, and palliative care physician based in Boston. Shayla?
Thank you, Hector, and thank you for not giving me a nickname. Good afternoon. I'm delighted to present a GLMA Achievement Award to the National Queer and Trans Therapists of Color Network. The NQTTCN advances health justice by transforming mental health for queer and trans people of color. At the core of their work is a commitment to social justice principles, an expertise in mental health, and a deep understanding of intersectionality across identities and spaces. Since its launch in 2016, the NQTTCN has worked to bring healing justice resources that are aimed at addressing widespread generational trauma from systemic violence and oppression into mental health spaces. This allows for less discriminatory, more inclusive, and more effective care for trans and queer people of color. In addition to facilitating access to healing justice resources for queer and trans people of color, for example, through the organization's Mental Health Practitioner Directory and its Mental Health Fund, the NQTTCN trains mental health practitioners to increase their understanding and practice of healing justice, and works with social justice organizations to incorporate healing justice into their movement-building efforts. At a time when COVID-19, racial injustice and unrest, backlash towards LGBTQ+ communities, and anti-trans legislation are surging, this organization's transformative interventions are vitally important. The NQTTCN is leading the way to help our communities of color recover from trauma, violence, and systemic oppression while transforming healthcare. Today, GLMA's board is recognizing the NQTTCN as a leader in healthcare. We thank you for your important work. Accepting the award today is Erica Woodland, the founding executive director of NQTTCN.
Greetings. On behalf of the National Queer and Trans Therapists of Color Network, I would like to express our gratitude for this GLMA Achievement Award. The work we do as LGBTQ healthcare practitioners is pivotal. We know that our communities need our care and support now more than ever. We have a responsibility to provide care that's rooted in dignity and justice for all people. And what we know is that our healthcare system is failing many of our communities. And so it is with gratitude and reverence and support for queer and trans people of color who have paved the way to ensure that our communities are treated with the dignity and support we deserve. It is also with honor and reverence to all the healthcare providers who are fighting back against queer and transphobia, white supremacy, ableism, and the impacts of poverty and lack of access to healthcare across the board. Thank you so much for this award. Thank you so much for the work that you do. And we are honored to be one of GLMA's Achievement Award recipients.
Thank you for your remarks and congratulations on your well-deserved Achievement Award. I now want to turn things over to Jenna Rapues and all of our plenary speakers who will lead this important discussion on the health and well-being of trans women of color.
All right. Thank you, everyone. My name is Jenna Rapues, and I see we have our slides up. Again, my name is Jenna Rapues. Use she, her pronouns. So delighted for me to be invited today to lead a panel and sharing space with some visionary, phenomenal transgender women of color working actually and leading spaces in healthcare. Just wanted to also note that we have a diverse voices in the panel to ensure that our perspectives really hone in on this idea of trans girl magic. With that, I'm going to keep up the slides a little bit and do invite you to read the bios because of time. But as you're reading the bios, I really want you to look at and think about some of the experiences that we as panel members, community advocates, professionals, trans women of color in the healthcare space, how we've navigated some of those spaces to be where we are today. really honing in the idea of restoring hope, healing, and power in healthcare. So just a little bit about myself. Again, Jenna Rapwest, use she, her pronouns. Currently, I'm working at the San Francisco Department of Public Health, where I lead Gender Health SF, which is a surgery access education program for serving our public health populations in San Francisco. Before that, I'm thinking about like how how GLMA particularly invited me to lead such an important panel, particularly serving and highlighting the voices of trans women of color. And I think back about how I got to where I am today, and where I started, where I actually really started. I think back about when I first decided to choose to medically transition back in 1999, where there were very few role models and elders who I looked up to, while also navigating the space of trying to transition at a time when so much transphobia and discrimination existed through race, trans people. So with that, I think back also to when I started, and how, the context at the time when I started to transition in 1999 in terms of what was happening. Growing up in San Francisco, I decided that I wanted to dive into public health, just because as a queer person in San Francisco, so much of the time was centered around HIV, and so much of the effects that it had in LGBT communities in San Francisco. So I think about like what was going on at the time. Many of the folks that I looked up to who have supported me in my transition, and the decision to really want to make sure that I use my positionality to respond to what was going on in San Francisco. So with that, my interest was, to really get into public health school, to get more information around the data that didn't exist for trans people, and this ongoing narrative around trans discrimination and transphobia, exclusion of folks, and also similarly to at the time when I was in school, very little systems were created to ensure that trans people were thriving in school as well. So in those contexts, I recognize that, so much of our framework around thinking about inclusion of trans folks in schools, thinking about exclusions of trans folks in HIV data, in the way in which you think about best practices were non-existent essentially. So that's just important context to think about as we hear from our panel members as current leaders in healthcare. So with that, I do want to go on to the next slide. And so much what I'm talking about is, so much of the work that many of our ancestors have worked towards, who were, who we looked at as like basically our role models, such as Marsha P. Johnson, Celia Rivera, and Miss Major, who many of us looked up to as role models or consider as transcestors, living legends. We know that Miss Major is currently still living. And so much of the work then was really paving the way for way we think about inclusion of trans folks and LGBT movements and rights, and really challenging the systems of oppression that really continued to silence us and victimize trans folks. So I also see these women as radical trans visionaries who have paved the way for many of us today, who many of us actually have led us to careers in healthcare. And, just wanted to recognize how important that is for us, and how we think about how we are changing the way in which we think about equitable, inclusive healthcare for trans folks. A quote by Miss Major: "I'd like the girls to get a chance to be who they are, for young transgender people to go to school, learn like everyone else does, and then get out there and live their lives, not afraid of thinking that the only solution for them is death." That quote is quite powerful in the sense that many of the women, at least in my generation, never knew or never even imagined having to live a life beyond 45 years old. Many of the women in my generation relegated their existence to sex work, to not even imagine that they could have a dream or having a future beyond what was determined by them by society. So important for us to think about that and kind of really honor the spaces that many of our ancestors and role models have really paved the way in terms of equitable access and representation in healthcare. So with that, really grateful to be joined by phenomenal trans women leaders in healthcare, really having an interdisciplinary voice and perspective that will allow us to really think through and invite us to think about how we support healing, restoring hope, and restoring power for our communities. So as allies and colleagues who are listening to today's session, I really invite you to think about, as you listen to our stories and struggles and visions for inclusive care that centers our experiences as trans women of color, I invite you to call and reflect on and ask yourself, as you're listening to us, how you're really centering the experiences, leadership, and voices of trans women of color in your work, in research, and clinical practice. Particularly, what kind of workplace practices or leadership pipelines are you creating, or workforce development and clinical training opportunities are you creating in your work site to ensure that there's equitable access for trans women of color today to take leadership in these spaces. Similarly, how are you actively supporting the liberation of trans people or BIPOC people? So much of the experiences of trans women of color have been about service provision or have been about victimization, and so much more work is needed around how do we actually center leadership for many women like us to take up into these healthcare spaces. So with that, I'm going to open up the panel to my colleagues and guests, and we'll invite each one to really share their story and how they got into the field of healthcare. With that, I'm going to start with Vida.
Hello, thank you, Jenna, for a wonderful introduction. And thank you all for being present. Not easy being present at the very last session. I dream that one day the first session of the conference will be BIPOC trans women. But for the moment, a little bit, you've read my bio or you have access to it. Sounds all professional, but honestly, I wasn't, I didn't pop out the womb being a professional. So a little bit about how I got into the field of healthcare. So the story goes for me is that I struggled in my undergraduate years, early 20s, late teens, with confronting the truth that despite being assigned male, that's not necessarily who I am, and trying to figure out in 2000, 2001, how I'm going to make that switch, considering that while having proximity to whiteness, being a immigrant, child immigrant from Iran, escaping the Iranian Revolution, just how the hell am I supposed to communicate this to parents who were basically taught about traditional gender roles through a Persian culture that, very, very misogynistic, as I would say, looking back at it. But it was that struggle with finding my identity that also translated to my struggle to find my identity as a professional. See, what a lot of people don't know is that my bachelor's degree is in electrical engineering. And yeah, it was never something I wanted to do. It was definitely something that I realized in hindsight was shaped by the trauma of just wanting to please and obey my adult caregivers and make sure they're okay and they're happy. Because certainly my experience with acculturation, originally from Iran to France and from France to the United States, it definitely made me a timid child, and I was not one to want to ruffle feathers. But believe this, once I kind of plopped right into the correct gender identity as well as the correct profession that I was meant to be in, I have no issue stirring up trouble, good trouble, a la John Lewis. And so, yeah, the work that I do is really, in a lot of ways, inspired by my transcestors. I like to imagine that they dreamt that one day someone like me would exist. And in the same way, I dream of a lot of these kids who are being essentially bullied through legislation, or I should say by legislatures. There's people making decisions, the welfare of these children's lives. And interestingly enough, doesn't mandate a Child Protective Services abuse report. Who knows how things change. So yeah, you could definitely tell I'm very passionate about my community, so much so that I felt that in order to contribute to the next generation, but also to learn, I took it upon myself to reach out to several young trans women of color that through the course of time, I follow on Instagram and really build connections. And these are women who do, as Jenna mentioned, some in the population still survive off of sex work. And just creating this family has been the most wonderful joy and has brought a lot of personal healing. So I definitely feel like I learn from all generations. And that's really what I'm about and what I want to keep as a healthcare professional is to continue willingness to learn. I don't ever want to feel like I figured it out and I got it, because that's the moment the hubris gets you. And I imagine that could apply to all of you as well listening. So, and thank you for listening.
Thank you, Lita. Marcia, do you want to share in terms of how you got into the field, or how you're taking up space right now in healthcare?
Yeah, I'd love to. So my name is Marcia Barnett. I'm from Houston, Texas, and I'm actually very fortunate to be a medical student. I'll be graduating in this December. And I think like many other medical students, my journey is informed by the fact that I have other family in medicine. You can look at my skin color and know for a fact that that's unique. That's something that's out of the ordinary. And personally, I was always told these great stories about my family, and that's what really inspired me to go into healthcare. My grandfather, Herman A. Barnett, he was the first Black man to graduate from the UTMB Medical School in Galveston. He wasn't even officially a student there. He had to petition to the NAACP to have him admitted as a secondary student to a Negro college that then allowed him to go to medical school. He had to take his classes in the hallway. He was beaten by police because they thought he stole his medical school class ring. And I never met him, unfortunately. He died when my dad was still very young. But I think it's really the family that really got me into healthcare. And I realized that I'm exceptionally privileged to have that family background, considering my race and where I come from in the Deep South. I never had to take it for granted. I never had to question the fact, could I be a doctor? I had the example right there. I always knew it was something that was open to me if I was willing to work hard enough. And like my family always told me growing up, I always had to work twice as hard to be respected in school. And that's an ethos I took to me all through my elementary, high school education and on into college. When I went to college, I went to Morehouse College in Atlanta, Georgia. And for those who don't know, it's a historically Black college, but also it's an all-male college. And the school has really founded itself on the reputation of alumni like Martin Luther King, on this idea of social justice and making what they call the Morehouse man, essentially combating negative stigma and producing Black men of excellence, people who can go out into the world and then be respected. While I was there, actually, they had a dress code policy saying you could not, quote unquote, cross-dress. This is essentially just saying, if you are transgender, you are not a Morehouse man. They had to put rules in place against that. They had regular speakers who would talk about how queer Black men at Morehouse, people who would dress more effeminately or who had various gender expressions, were less than, as if they were tarnishing the Morehouse man aesthetic. I began transitioning my senior year there. And really my whole transition journey from the very beginning was based on this idea of trying to find the strength within myself, knowing that I can be in medicine, I can be a doctor, but also realizing how strongly misogynistic the world is and how I'm going to be combating this, this disempowerment throughout my entire life. That's something that I found to be true as I graduated from Morehouse and as I went into medical school at Baylor College of Medicine in Houston, where I got very half-hearted support from administration, people who are otherwise very well-intentioned, but I think they didn't realize this, but they were perpetuating stigma, they were perpetuating pain, they were perpetuating discriminatory factors that would keep other people like me from existing at the school. I'm so fortunate that I have my family, and that's been my inspiration, but I realized how privileged I am that my family was able to keep me on their insurance, to pay for my legal transition. If I hadn't done that, I would not be able to have my name changed on my legal ID and on my ID at Baylor. Imagine going through school like that. And I know transgender people at Baylor who had that problem, who were not recognized as their true gender because of, these weird institutional barriers that persist for no other reason than because people really want them to. I'm also a dual degree student, as you can tell by my title. I got an MBA from Rice University. So as I've gone through business school as well, in addition to medical school, I realized just how many factors cause people like me to not exist. There are economic factors, there are legal factors, there are medical factors. I'm really just truly grateful to be here, to even be alive right now, to be working in the medical field. We had other speakers earlier in the past few days talked about how they had to do sex work. That's what they did. And I don't mean to denigrate that. I think it should be decriminalized and I think it should be respected. But I am thankful that I didn't have to do that to afford my transition and to continue my path into medicine. It's already difficult enough to be a medical student, to apply to the board exams, to apply to residency is already thousands of dollars. Imagine trying to pay for that on top of needing to pay for transition-related healthcare. It's virtually impossible. I take that with me all the time, just realizing how grateful I am to be here. And just honestly, I know that there's people out there who need to see me in medicine. And regardless of how I feel, it's really about them. That's really what keeps me going through medicine. And in the future, I hope to go into surgical fields. I love surgery. I love working with my hands, but unfortunately, that's a field of medicine, which is awfully represented in LGBT care, even in just minority representation among physicians, LGBT representation among physicians. I have many stories to share, but there was one time on my general surgery sub-internship, I mentioned offhandedly about trying to find a woman partner. And my resident goes, oh, hold up now. We don't need to get all weird about this, as if being queer in and of itself was a strange aberration to be, in addition to being a surgeon. I don't think that should be the case. And I'm going to continue to be out loud and make good trouble into the future.
Thank you, Marcia. Ms. Isabella, do you want to share kind of how you got into the field of healthcare and bits of your story? I know you a little bit, but would love to hear how you got into the field.
Yeah, well, first I'd like to thank you for the invitation and for this opportunity to be a part of this amazing panel of strong trans women. My name is Isabel Ventura. I'm currently a practicing provider at Lion Martin Health Community Health Clinic here in San Francisco. My training is on adult gerontology, primary care. I did the HB minor at UCSF. So I think my story and my journey into the healthcare field is completely different from everybody else, I think. It's actually what drove me to pursue a career in medical field is because it's a necessity. It's driven by my trauma and my negative experiences in medical settings. It all started back in more than 20 years ago when I migrated to the United States from the Philippines. During those times, we actually the term transgender and transgender health is actually is a concept that is not known to most providers. So every time I ask a provider for hormones or any other trans-related services, they will either ignore me or pass me along to another provider who doesn't know what to do with me, until I met a provider who is willing to prescribe hormones. So this story, I think, looking back, really motivates me that I will do anything and everything to change the delivery of care to trans community. So I remember crossing the border to Tijuana just to get hormones and self-administer it without any other blood work. And self-medication of hormones common, late 90s, early 2000s, because there's not a lot of guidelines really on how to care for trans people. And then, so as an immigrant trans woman, I actually don't have role models in terms of who've been to college, because I'm as a first generation who finish grad school, who finish bachelor's, who receive a bachelor's degree. I grew up in a really rural, poor town in Cavite, which is an hour north of Manila. So I didn't really have a role model to look up to. So I have to learn everything on my own. It took me at least 17 years, I think, to finish. It took me 10 years to finish my undergrad, and then additional 3 years to complete my master's, my graduate degree. So, I think a lot of it's because of the people that believes in me. Usually they're trans pioneers in research as well as in public health, such as Joanne Kidley or Cecilia Chung, who sort of really guide me and supported me and mentor me and to push through and to create spaces and to create opportunities for trans people, and to create opportunities in areas where I think that are lacking. I think one of the things that I usually, tell myself is that, we are only expected to live a certain number of years, but you just have to to prove something that you can do much better, and then you can leave a legacy to the future trans folks that you can do it as long as you maintain focus and remain focused on what you want to achieve in life. Yeah, thank you.
Thank you all so much for sharing your stories. And so much really resonates with me as well. As I was trying to make sense of my own personal pathway getting into the field, particularly as one of the elders in this panel, one of the elders in this panel members. I think back, as I mentioned earlier, I transitioned back in 1999, and so much of what you all shared around, lack of having to experience negative experiences in accessing healthcare, being denied care, being misgendered, all these things really resonates for many of us as trans people, as trans women really trying to live our lives fully and authentically. And I think that's just very shared similar spaces. But also too, I think the thing that really resonates and highlights all too is that we navigate many different layers of our identities that are intersectional, right? As an immigrant, as a Black person, as someone, different kinds of navigating different experiences with class. And, I think those just are realities that many of us and hold and navigate. And even relationships with trauma, because trauma is such a big prevalent experience that resonates a lot with trans people. And so I think that's just really important. And as I mentioned earlier, for me, I'm not a clinician, but I have, I own the fact I lean on the fact that I have the lived experience that really informs and guides my work, and uses that as a way to imagine and build and inform and lead the way in which we think about inclusive care that's equitable and that's representative of our communities. So thank you all for just that wonderful share of your experiences and voices. I know we're quite an interdisciplinary team. We all have unique lenses. I know, Lita, you're a mental health clinician, practitioner. Marcia, you're going to med school or almost completed med school and possibly going to go into surgical practice. And then, you know, primary care provider, Ms. Isabella, and me. Again, I'm not a provider, but I actually lead programs, which is kind of an interesting space for me to be in. In terms of kind of all of our kind of unique voices and perspectives in our personal work, you know, can you tell us about kind of like those unique things that brings you into the space of work and what you're passionate about, what you are doing in your own respective places of work? Lita, do you want to share?
I would love to, especially because I heard you say you're not a clinician, yet I would argue you're more qualified than a lot of people who are licensed clinicians when it comes to doing the gender work. And really what I mean by that is a concept that I have recognized just doing clinical work, majority of it in private practice, but also in nonprofit settings with systems involved youth of all genders, as well as had a little stint at a medical facility, along with working with the local county, getting a contract to increase gender affirming care. And I would say that what healing looks like for trans people is really understanding the complex trauma, which I refer to as gender-based complex trauma, the way that we have concluded certain things about ourselves to be facts. And a lot of these things are propagated by, you know, folks in institutions that are anti-trans and trying to propagate false narratives about the trans experience. And that if we can understand that a lot of our complex trauma of existing in this universe has shaped, you know, our own perspective, our identity, and to release that and what does releasing look like? I think for me, it's really about helping people rewrite their narrative. And I find that it gives me a lot of comfort that I hear a lot about, you know, rewriting or owning your own narrative also in a lot of social justice and equity work as well. And I think this goes further for me to recognize a population that's further marginalized, and that is those people who are disabled, autism, neurodivergent, in the way that healthcare systems weren't really designed with them in mind. And so a lot of things look like pathology when they're not. So I definitely make sure to bring a neurodiverse affirming approach as well as a gender affirming approach. And really a lot of the work I do as an advocate and ally is to make sure I'm listening. And even I myself have contemplated about identifying as neurodivergent. It is really a struggle to do that, and not because of any shame, which is something I may have had as a child, more so of me taking up space, because from the surface, I am someone who appears to function well. Yet as I've had to question the way I live my life, and I have created a lot of infrastructure to help me deal with overwhelm. So I think there's so much more that could be said on this subject. But essentially, what does healing look like? You know, it could be designed by us. And Jenna, I know you and I have already kind of started that through some discussions. And yeah, I'd love to continue these conversations with, you know, all you ladies and anyone else in community. Thank you.
Fantastic. Thank you so much. Marcia, do you want to maybe talk about your current passions and your work, and kind of also how you're deciding to pursue surgical practice? I think that's one of the things that really is very exciting. There's not very few people, particularly trans women of color, who would want to pursue that field. So
yeah, no, it is definitely unique in that wanting to be in surgery in the first place. I all the presentations I've heard here, seeing all the people present, everybody's wonderful, but there's such a lack of surgical representation, unfortunately, not just, by Black people, not just by queer people, but really all of it. I think for me, my practice of medicine, unfortunately, is a little constrained as a medical student, but even as a resident, it's also constrained, but I think it's really informed for me by intersectionality, really trying to be a surgeon, to be a medical professional, to be Black, to be trans, all at the same time is incredibly difficult. And in medical school, really, so much of it is about cultivating the personality of a physician. You have to set aside your previous experience as a layperson. You don't get to be a layperson anymore. You are a physician, and that requires not just a lot of academic work, but a lot of emotional struggle too. They talk about the hidden curriculum in medicine, if you go into medical school, about all these little implicit things that you have to do to be a physician. And more often than not, that means putting aside your other identities, putting your physician identity first. I think that is completely contrary to the way I would like to practice medicine. I always prefer to bring all of myself to the table as much as I can. But really, there are so many opportunities where that does not get to happen for me. I mentioned the one story before about how when I was working with the surgical team, I mentioned just one aspect of my identity, me being a female attracted female, and how that was met with so much confusion, so much, just feeling that was out of place in medicine, which I absolutely disagree. I think it is. I think you need to bring your whole self to the table. My experiences as well have also been informed by the fact that I've had, unfortunately, very discriminatory attendings who have had to work under. And as a medical student, you don't really get to say a lot about that. You don't really get to complain. You certainly can anonymously, but it's a question of if anything will be done about that. Again, on a rotation, I remember hearing two residents talk about how an attending was discussing his trip to some remote exotic location and saying so many denigrating things about transgender people. Awful slurs that I won't dare to repeat, but this is the culture that surgical residents are exposed to. This is the culture that the hidden curriculum of medicine says is okay for surgeons to have. And I think that's probably one of the basic reasons why people do not want to go into surgery if they are queer or minority identified. If somebody could find me another trans queer surgeon of color, please give me their contact information, because I don't think any exists, quite honestly. I know of two transgender surgeons. Both of them came out years after they had already established their practices as attending surgeons and have developed an academic rapport and were respected. I think for trainees, particularly myself, that is so difficult to do. That is so difficult to be out and also applying into surgery. You really don't get a ton of options. You get to pick one or the other, which again, I disagree with. I'm going to keep bringing my whole self to the table. My other experiences in medicine, I think, have largely been informed, as a trans woman, have been informed by me needing to educate people who ought to be educating me, which is heartbreaking. It's really unfortunate. On psychiatry rotations, the attending asking me awful and personal questions like, wait, you're a lesbian? Oh, wait, what? You are queer, you're trans? I would have never guessed, which is exactly the opposite thing of what you want to say. I think so much of what I hope to do in medicine revolves around me continuing to be loud and out about my identity. I think with regard to plastic surgery, that's the field I really want to go into. You have this really strange dichotomy also existing there. You have plastic surgeons who view gender affirming surgery as the next big thing in plastic surgery. Everybody wants to go to a gender affirming fellowship. You hear so many people talking about it when they are actually applying. or as something they want to do. Yet, so many of these folks have little to no experience with actually knowing transgender people and knowing the cultural humility factors that make a plastic surgeon a good plastic surgeon. My own experience, receiving plastic surgery, I got almost all the way through, and all of a sudden, the informed consent disappears as I'm forced to jump through barriers and hoops to receive surgery. A lot of people will continue to do this, thinking that that's the right thing to do, not knowing, actually knowing the people and having the personal experiences to know that informed consent is the thing to do. With regard to general surgery, as a resident, you don't get to really pick your patients. You take whoever comes to you. In particular, surgery. That's a very different field from internal medicine, psychiatry, and peds, where there's a lot more autonomy on behalf of the patient in terms of choosing their provider. If your gallbladder ruptures, you don't really have any choice but to go to the closest place. And whoever takes out your gallbladder, you're just thankful they're doing it. But I think that itself is a situation that's rife for mistreatment of transgender people, of queer people, of minorities in general, because you have people, you have the surgeons who feel that you have to come to me. I'm the best, I'm the most qualified surgeon. I've done X number of procedures. I have a great rate of not having complications, and you're gonna have to deal with it. And I think what really is the worst part about that is that the field of surgery has such a strong cultural influence on the rest of medicine. You see Grey's Anatomy, you watch any medical TV show, the people you see are surgeons. You don't see the internal medicine people. And this is what people broadly, generally see as the culture of medicine. I think surgeons have a lot of power in terms of changing the way that transgender medicine is practiced, but many people don't do it. They do not care to be culturally informed, or they think that what they're doing is fine enough, and the voices have not been made loud enough for them to really care. I think, again, other experiences I've had, just when you're practicing, there's so many institutional roadblocks that one comes across that I would love to be able to break down. You have patients who you are able to treat. You have the knowledge. You can give them top surgery, but the Children's Hospital doesn't say you can do it because they just don't do it, because of whatever personal bias of the board of the institution. I suppose to try to put a bow on all of this, what I would like my future practice to be, and what I hope my current practice can be, is that I want to be able to be completely authentic, to bring my whole self to the table all the time, to let patients know who I am and why that makes me a better surgeon. You get to know all of me, and that makes me better. I'm not going to hide parts of me because it's more convenient for you, even though sometimes, unfortunately, as a resident, you have to. You don't have a ton of power as a medical trainee. You're often just at the whim of the institution you're at. And there's a fine line for me personally to be had between making good trouble and trying to change policies, but not making too much trouble that you're then the resident that needs to be reprimanded. You're the student that needs to be reprimanded, and maybe you should be quiet. So it's a very difficult balance to find.
That's beautiful, Marcia. And I think it goes into that idea of so much of our personal experiences inform so much of our work and what drives us to work back and get back to the community, to our communities. Miss Angel, Isabella, I heard you earlier talking about, being on the receiving end of healthcare, right? As a trans person. And now you're on the other side, which is actually providing care for a lot of queer and trans folks. That's a really interesting space to be in, not just as a trans person, but as a trans woman of color, where there are very few who are actually on the provider end leading that work. What informs your work, and how, what motivates you, and what sustains you, and what drives you to provide this level of care for queer and trans people?
Thank you, Ms. Jenna. Oh, I'm hearing side voices right there. Anyway, so I usually base my practice as a primary care provider on I provide primary care the way I want to receive primary care, right? The way I want to receive healthcare. So oftentimes, trans people just wanted to be heard, and I think that that's a very important, practice that by allowing our patients to voice out their concerns. I know that a 20-minute visit is not enough to sort of like capture every concerns that our patients have, but I think, by allowing them sharing their concerns, you will get to know your patients more. You will understand where they're coming from, their background, their traumas. And by practicing, just actively listening to my patient, I think what usually happens is that I will realize that I share similar experiences with most of them. And then I sort of like guide the discussion based on what they really need that day. Someone who are, experience homelessness in my early 20s, someone who experienced working, the sex industry, and as someone who really, has experience with poverty. I think I realized that most of our, is particularly at Lion Martin Community Health Clinic, as well as my previous clinics that I work at, I've noticed that most trans people share similar experiences. And there's only like few and, that has like, capacity to, I think it's because of the clinic itself. We are a sliding scale clinic. We don't, a lot of our patients doesn't really have the capacity to pay for their healthcare services, right? So I think it's really, really important if you're a provider out there, it is important to just sit and listen in one of your visits. And that way you will get to know your patient, you will get to know where they're coming from, what's going on with their lives, instead of like just focusing on like, what do you want the visit to be and what do you want, like the goals of the visit. Another thing that I think is very important is like asking patients about their goal of transition, right? I think oftentimes we don't never, like during my graduate school, during when I was precepting providers, oftentimes they don't ask questions like, what do you, your goals in transition, for example, do you want to, have surgical interventions? Do you want just medical interventions? Do you want to be like in sort of like in androgynous space? So I think most providers will base their decision on recommendation and guidelines by the expert. For me personally, I usually base it on what the patients want. If they just want a low dose of hormones, a low dose of estradiol, a low dose of spironolactone, that's fine. I often allow them to just decide on what they want for their body because it's their body. Our job as a provider is that to provide them with information for them to make a valid decision, medical decisions. Yeah, I think those are the two things that I usually sort of like practice in my daily clinic hours.
That's wonderful. Thank you so much. And, I think as someone who transitioned in the late 90s and, have seen a lot as a trans person in the past, I think 25 years or so, I want to step back and put some context, right? Because 10 years ago, we didn't even have the word non-binary in our communities, right? That was non-existent. 10 years ago, many community advocates were struggling to be counted in HIV data and research and thinking about how trans people experience health disparities. And we know there's a lot of them for our communities, and particularly not just for trans folks, but for particularly trans women of color. HIV, substance use, mental health, unemployment, violence. And so I think those are just some of the realities, and so much of that context really informs so much how we've moved forward as a community, but so much more of the work that needs to be done. And oftentimes, even in my current work, I think about inclusion and data and representation and workforce development. I started at a time when there was only like 2 people at the department, 2 trans people, and now we have about, I think, 30 trans folks in the department, which is exciting. But some of that has to do with a lot of the work that we as a community have done to really advocate and to represent and to fight for. And so just want to really honor and recognize that power that we had as a community to be able to advance and represent. So much more work that we need to do ahead, right? To build leadership pipelines, to increase workforce development, to look at hiring practices that are equitable and representable, and to land on the idea of centering the voices of our Black and Brown trans sisters and siblings, right? So just really powerful work, and just so amazed by each and every one of you who is leading some of these work in your local communities. For any of the attendees, I do encourage you, we're gonna have the next 5 minutes or so, we're gonna have Q&A. So there's a Q&A chat box. I encourage you all to write a question, and we'll answer it to our panel. I'll ask questions to our panelists. But as kind of a final thought for our panelists, kind of want to, this idea of for us bias, right, really resonates with me as we're thinking about, healthcare by trans women of color for trans women of color, right? What does that really mean, and how does that really kind of support or land in the idea of supporting trans liberation? And what do we mean by trans liberation? Because one of the things that really matters for us in shifting and some of the paradigms in healthcare, right? So for you all, what does the future of trans healthcare look like, and how are you imagining shifting that so that it is for the community by the community?
I guess that's my cue. Definitely want to, because on the behavioral health side, we need more representation. I would love to start up a scholarship for Black trans women to earn a master's degree, and not solely financial, but one where there's a cohort of professionals who, mixture of trans people who are therapists, Black trans folks who are just professionally, maybe not in mental health, but working in different places. And just a shout out to Valerie Spencer, who is a Black trans woman therapist in Southern California. Look her up if you're interested. She does great work. I think the future is really, for me, about the truth being revealed. I thought of this quotation from the George Orwell novel, 1984. Who controls the past controls the future. Who controls the present controls the past. So the truth needs to be told. And one of the truths that is often neglected to be told, and just coincidentally, this is the Stanley BIBER Memorial Panel. Those who don't know, Stanley BIBER has gotten a lot of recognition for trans surgeries for trans folks, gender affirming surgeries. And yet so few times do people mention that the originators of gender affirming surgeries are all the trans people who took the risks, putting their bodies on the line. Because of Hollywood, we know about the Danish girl, Lily Elby, but still so many people unnamed that in the hopes of, relief from their distress, from the suffering that they, and so really, I feel like trans people need to get credit for how they have helped surgeons develop their skills. And so I feel like the past and the future is one, and we cannot forget the past and just keep moving forward at this point.
I think Lita really hit the nail on the head there when talking about recognizing the work and sacrifices that transgender people have made for medicine to be where it is today. I always think of science and medicine, we hear that phrase, we stand on the shoulders of giants, and we truly do. I'm only here because Marsha P. Johnson, started protesting. I'm only here because I had Black mentors, Monica Roberts in Houston, God rest her soul, but because I had people like that to show me, my trans sisters, my trans elders, to show me that it is possible to lead a fulfilling life as a Black trans person in the world. And I think for me, the future for us by us means continuing to elevate trans people every single opportunity that you get, to recognize that when you are at the intersection of so many minority factors, of being just mistreated in so many different ways, that you have a very unique insight into what needs to be fixed and how it needs to be fixed. And if you don't find those people, elevate their voices, and compensate them fairly for their time, then we will never have true equity. And I think what really needs to happen is that you elevate people every chance they get. My little PSA would be to the people in the audience. There are many people who practice gender affirming healthcare, which is awesome. But do you actually know any transgender people in your personal life? Have you talked to them outside of a clinical context? Do you know their passions, their dreams? What keeps them up at night? If you don't know that, I don't think you're truly practicing cultural humility, culturally competent care. I think you should take a good look in the mirror and figure out what you need to do to immerse yourself in the community that you are trying to help.
Okay, I think, thank you, Lida and Marcia, for these wonderful points. Actually, I will just echo, what have been said is that, it's really important to create space for trans people in medicine, in mental health field. I think it is important having representation, particularly with the minorities, gender and sexual minorities. I think historically the medical field and mental health field is driven by individuals who doesn't really understand what the population needs, doesn't really understand what the trans and gender non-binary patients needs. And they're making decisions based on what they think is appropriate. They're making recommendation based on what they might think is, is acceptable, but without really asking the patients themselves. So I think it is important. The representation is highly, highly important in medical and mental health field. So if you have any patients who are interested in the field, support them and let them know that it's okay. I met some, amazing professionals in the medical field in this particular, for example, in this conference, and that it's okay. You can achieve it as long as you focus, on the things that you wanted to do and to be in this field. Yeah.
Beautifully said. Thank you so much. We'll jump into our questions. I know we have a couple minutes left, and we have several questions that's listed. I'm gonna go, and we can just do this popcorn style if folks want to just answer. So, I mean, the first question is just related to trans youth, and particularly this idea of, and not just trans youth, but trans youth of color specifically, and how we can provide role models of support. I know many of us, some had some sort of role models, but many of us didn't, right? And so what kinds of work, in your work, are you doing any kind of work that's related to either supporting trans youth of color, providing some role models, and providing that level of support for them to thrive?
I noticed the question earlier and I struggled to name anything I'm doing that either intentionally is aimed to support trans youth of color, or just happens to contribute to that. And I think a lot of times when it comes to trans youth, there's so many trans youth that they themselves have not reported that they're trans, especially when you're young and you see kind of what the risks of letting people know your feelings. As I work with youth and in private practice, it's going to be mostly families with access, with wealth. So it's predominantly white. And I'm in San Jose, California, for reference, Bay Area, Silicon Valley, a lot of wealth. That even a lot of the youth, who are white, they are really timid and scared and frightened. I definitely think we need to, find a way to outreach. I noticed the person asking from Detroit. I think definitely recognizing certain areas of the country that could use that sort of help most. But I would love to know how to, target that population.
Fantastic. I'm going to jump into another question. How do we best serve those hard to reach populations, and particularly those who are uninsured, immigrant, or rural trans folks? Maybe perhaps I can share a little bit, kind of a response to that. So currently where I work actually works with, I want to say, publicly insured folks who are uninsured or accessing public health insurance, and are also working with immigrants. And so much of our work at Gender Health specifically or particularly is this utilizing this peer-based model, and utilizing peer navigators and peer models of approaching leadership as I land in that space. Thinking through how do we continually engage our most marginalized communities. And by that, I mean, people have to see themselves in the service, through the service that they're receiving. So many of the work that we do is employing peers, providing opportunities for training and education to build their experience. Many of those who we hire aren't necessarily have had formal education. And so again, this idea of building a workforce development opportunity or leadership pipelines for folks who may have never had these formal experiences. And so I think those are one opportunities. I think there's other ways to really support building such programs so that people can actually really see themselves, which will increase engagement. Other questions?
I can talk a little bit about that question too. I think that's a really interesting question because those hard to reach populations are also hard for us to reach too. Even as queer people of color, queer trans people of color in medicine, it's hard for us to reach them too. And I think the nature of that is just because of the way that we've developed our health systems. I know many people from Harris County. Texas didn't expand Medicaid, so our public health is done county by county, and they moved to California because they knew they could access gender-affirming care there. I think for the people who are in the most difficult to reach situations, that's because at some level the public health safety net has failed them. And I think the best way to do that is to go to the person running the county health department, person running the state health department, and tell them our laws, our policies are not reaching the people that matter. And it's the people in charge that need to hear that there are folks not being reached. And if they don't know, they will continue to assume that everything is A-okay.
I can also share my thoughts about the question. So at Lion Martin Community Health, we provide a sliding scale for individuals who cannot afford health services as well as mental health services. So I think, and I also have experience working like doing telehealth with individuals who live like in rural, very rural areas in California as well as in Nevada. So I think using innovative like technologies such as Zoom or even by phone, I think you'll be able to manage someone's health care needs. And so and another thing that really concerning to me is that like most organizations and clinics that provide health services to trans populations are sort of like not adequately funded. And so we really rely on supports of individual sponsors. And so if you have, if you have extra funds in your account, please donate. There's a there's a QR on my left side. So I hope you'll be able to support our work, so we can continue providing health and mental health services to gender and sexual minorities that's needed. Thank you.
Thank you, Angel. I think we have one more question. We have 5 minutes left, and I think we have a couple of questions, but I'm going to try to get through some of these. Another question that came up in the chat is related to what I had mentioned earlier, which is, non-binary identities wasn't even aware at the time, about 10 years ago. So much has changed with terms and identities, and and also just kind of our own understanding around the spectrum of gender identities, right? And kind of like that universe. The panel, one question was, what aspects of healthcare vocabulary specifically, or knowledge regarding transgender people are currently lacking, and would you like to see become more increased knowledge of or providers to increase awareness of care for trans folks? What areas of healthcare do you think are kind of gaps? Where is it, like vocabulary? Is it providing, particular gender affirming care practices?
Yeah, I would say vocabulary is always evolving. So even I won't even know. That's why I look to the youth. I see them as being wise beyond my years, because the environment they're growing up in is much more nurturing, to much more celebratory to be themselves. I still have a lot of internalized shame that I was raised with. I would say also look at trans creatives, look at films, documentaries. If you want education, unfortunately, there's no CEUs, but check out Pose, check out Veneno, check out anything, following people's names, Zachary Drucker, Trace Lissette, Angelica Ross, Isabel Sandoval. I could just go on. And I think it's important really to let us explain the language to you. No more TikTok videos about people identifying as helicopters. That's BS. It's just really listening, and it goes so far.
I think another aspect that commonly gets missed, in my personal experience in medical school lectures, we talk about, gender affirming care, and it's pretty much only in the respect of receiving hormones, maybe a case study or two on a trans man who is trying to become pregnant or trying to chest feed. But I really think that what is really lacking is a broader perspective on how transgender people interact with the healthcare system as a whole. Trans people have gallbladders, livers too. I think really and not enough is done on how trans people experience care in more broader context, aside from specifically gender affirming care and specifically aside from gender affirming surgery. There's a lot of things that need to be, a lot of questions that need to be asked, and a lot of questions that need to be answered.
Thank you. Ms. Angel, did you have in terms of what do you think might be helpful for providers?
Oh, I'm sorry. I'm like trying to respond to one of the questions. I'm sorry. I wasn't even listening. I think I'm going to skip so I can respond to this question. And one of the participants, is that okay with you?
Thank you.
Okay.
Well, I think we're like 2 minutes to closing. I think in the interest of time, I think we will wrap up. But, really grateful for each and every one of you to share this space. Not just, sharing the space, but really, what I was trying to say earlier that I didn't get to say is that we are this group of really lucky trans women who have made it and were recipients of the gifts that many of our ancestors, many of our elders who have paved the way for many of us to be at where we are today. The reality is very, very few of us leading these spaces in healthcare. challenging our systems, really challenging the way in which, discrimination and transphobia continues to persist for our communities. And so, again, as I invited many of our allies, colleagues, and those who are listening to today's session, really think through how you can bring back some of these knowledge back into your spaces to really commit to, again, centering the leadership of trans women of color, challenging the systems that exist that perpetuate bias and discrimination to many of our communities. So with that, thank you each and every one of you for being here, and grateful to be able to share this space with you all.
Yeah, I'm grateful. I'm so privileged to be able to be a part of this panel. Thank you all.
Well, thank you, Isabella, Lita, and Marcia, for that incredibly rich discussion, and especially to you, Jenna, for leading us through that. Really to leave us with the question, what are each of us doing to center the voices and leadership of trans women of color is such a fitting way for us to move forward from this conference with our theme of closing the gaps. So amazing plenary, thank you very much. I'd like to extend GLMA's thanks again to all the Nursing Summit and conference speakers for sharing your experience and expertise and time with us. To our conference co-chairs, Vice President for Education June Quoque and Francis Grimstad, the entire Education and Peer Review Committees, Nursing Section Leadership, and the GLMA Board of Directors, huge appreciation and kudos. And finally, thanks to all of you out there for being here and participating in the GLMA Annual Conference on LGBTQ Health. Don't forget about the HPIT Social in about an hour, and we'll see you next year in San Francisco. Thank you.